So, having said that, there is we part of what we do during antenatal clinic include regular visits. This allows us to detect if there's any issues and allow for timely intervention. As we said, it's a kind of preventive care, so to say, because the patient might not even have any symptoms or any complaint. That's one of the things we do tell our patients when they come to the clinic. Some of them will say, if you tell them you miss your clinic, they will say, no, it's because I'm feeling okay. I don't have any complaint. No, there might not be complaint, but there are things that could be picked when they present during the clinic that could impact negatively on their health. That when discovered and we intervene, it's going to kind of reduce the complication that could arise during the course of the pregnancy. So these are the importance of antenatal care. Like like I mentioned earlier, it prevents. It prevent complications. What are the likely complications that will come with pregnancy? We mean something like gestational diabetes mellitus. This is a kind of elevated blood sugar during the course of pregnancy. It is that is the first time that is being detected during the course of pregnancy, and it could impact negatively on the health of both the mother and the baby. Also, to prevent some of the things that could be prevented include preeclampsia and infections. Preeclampsia is just a condition whereby there is elevated blood pressure with protein in the urine, and this could result to a lot of complications, which I will talk about along the course of the presentation. Then it also allows us to give them talk about health education. We educate the mothers about the nutrition, the exercise, lifestyle habits. The nutrition is in the sense that we let them know the combination of food items that could impact positively on their health and the health of their babies. This include we encourage them to eat fruits, vegetables, and also protein diets, vitamins. Of course, we often supplement some of the vitamins, especially the iron, the vitamin C, folic acid, just to ensure positive pregnancy outcome. So exercise, moderate exercise, we encourage them to do moderate exercise because of their pregnancy. Why? Because it keeps the muscles, their bones and muscles fit, and it prepares them for the delivery that will soon happen at the end of the pregnancy. Also, lifestyle habits like some of them that might be smoking, though not common in this part of the world, but it's a possibility. We encourage them to stop because it could cause adverse effect on their pregnancy. Drinking of alcohol. Yeah, there's something we call alcohol syndrome in the baby. So we encourage them to reduce or even stop. And also, I know some people love to take coffee. So coffee is not also encouraged, or yeah, we discourage it. There are a lot of food that are not supposed to be taken in the course of pregnancy, but I won't be able to exhaust all of them because of the time. But if there is any question about it, we can talk about it during the question and answer. Then it also allows us to monitor the baby, the growth of the baby, the the growth. If there's any structural anomaly, ultrasound can help us detect this. Also through the blood test and other diagnostic tools that we can use. Then it allows us to detect some complications early and able to intervene early. Complications like elevated blood pressure, anemia, infections, So these are some of the things that can be picked on time. And the like I mentioned earlier, is a form of preventive medicine. So when we discover it on time, it gives an ample time. When a woman register or start antenatal clinic on time, we have enough time to detect this and work through the investigation and give the appropriate treatment. But if such woman is registering or booking late, we might not have enough time to do all of this, and it could impact negatively on the outcome of the pregnancy. Emotional support. There is no doubt that pregnancy could come with emotional and mental disturbance. When they present for the antenatal care, we're able to give them counseling, support them, address their concerns, even to an extent that if there is need to involve social workers to get to the root of their problems, we offer this as well. So you can imagine if we are able to achieve all of this, yes, we are expecting elder mother and baby, an happy family. So